Well, good morning. And so we do want to officially start our next training in our webinar series. We're going to be reviewing the Strategic Prevention Framework today. So thank you for joining us. I'm Julie Hiven with the Iowa Department of Public Health, and also joining me is Katie B. So we will be going through the SPIF process with you today and talking about each of those steps. So a couple of quick reminders before we dive into all the material. This meeting will be recorded. We will be sharing the links with you and the training materials. Please make sure that your microphone is muted. You should have been muted when you came into this call, but sometimes you can hit a button and unmute yourself accidentally. Please make sure that you keep your microphone muted the whole entire time. You can find the microphone icon. It's actually next to your name in the list of attendees. So you can see there's a little line through the microphone if your line is muted. So please make sure you do that. We will address all questions in the chat log feature. So as we're going through the webinar today, if you have any questions, feel free to just type those in there. It's a good way for us to document what questions are asked as well. And we will make sure to address all those questions at the end of our time together today. So this is the overview of what we'll be discussing. Like I mentioned, we are going to be talking about the Strategic Prevention Framework, or the SPIF for short. And so we're going to be discussing all the different SPIF steps, and then we will be addressing any of the questions that you may have at the end of our time. So we want to start out by talking about the importance of the SPIF and why we have to really take a good look at utilizing the SPIF in the IPN grant. And you probably, if you've been around in prevention for a while, you have probably known that the Iowa Department of Public Health has received a couple of discretionary grants that have really focused in solely on the SPIF process. So, and even with the block grant, the IPN grant, the SPIF is a requirement. It's an expectation. So how we utilize the SPIF process may not be exactly how we've done it with some of our discretionary grants from SAMHSA, but a lot of those lessons that we've gleaned from our discretionary grants, we will certainly utilize as we're moving ahead. Just know that you may see, if you've participated in some of those discretionary grants, you may see some similarities, but it won't exactly be the same. And we know that SPIF is really, provides a really strong foundation for the services that we want to implement. And SAMHSA states that prevention professionals use SPIF as a comprehensive guide to plan, implement, and evaluate prevention practices and programs. So, hopefully at some point so far in your prevention experience, you have seen this lovely flower, or sometimes folks call it a wheel, but this is the Strategic Prevention Framework, and each spoke of the wheel or petal of the flower has a different SPIF step. So, and then in the middle are the guiding principles of the SPIF. So each of those two guiding principles overlap in each of the SPIF steps. SPIF is actually a creation from SAMHSA, and for a long time, and some of you have probably heard me say this, I didn't necessarily think it was anything very unique or special. If you've worked in the education field or if you've worked in the business community, you may have seen something similar to this model. But SPIF is unique in a couple of components, or maybe in the time that I've utilized it, I've realized it's a bit unique. One is those guiding principles, those two guiding principles that are in the middle of the flower or the wheel. Those are really important as we're thinking about any of our prevention services. We want to make sure that everything we do is sustainable, and everything we do, we want to make sure that we're looking through the lens of cultural competency or responsiveness. And I think that is a really important component of the work we do in prevention. Another, I think, unique piece of the SPIF process is that we look at dosage and frequency in the SPIF, and those are probably terms that you've heard maybe throughout some of your time. We've used them more in probably the last 5 to 10 years of the work that we do in prevention. Dosage is about the percentage of the population you need to engage in order to see an impact in the work that you're doing. In some of our discretionary grants, we kind of use 50% as a tipping point. And so how much do you need to make sure that you're connecting? Which part of the population do you need to make sure you're connecting with in order to see a change? And then frequency is how often you provide a service to make a difference. We used to believe in prevention, and people get upset when I say this, that one was better than none. And we don't really believe that necessarily anymore, that if you can't do enough of a specific type of service through the funding stream that you have, then it may not be worth the effort and the time. We want to do things that work. We want to offer services and enough frequency to make sure that it's working. Another key component is that SPIF really is community driven. And if you don't have community members at the table, you're not going to see success. I have repeatedly said that SPIF cannot happen in your office. It cannot happen just through your prevention team. It can, but guarantee that you will not see the successes that you may see if you're engaging community stakeholders and community members. That's a really key, important component. So now I'm going to turn it over to Katie, and she's going to talk about assessment. Oops.
All right, well, good morning, everyone. So we are going to, over the next few minutes, talk about the first step of the strategic prevention framework, which is the assessment piece. And this really identifies the importance of having data-driven prevention services within your service area. So again, step one of the strategic prevention framework, or the SPIF, helps prevention professionals identify pressing substance use and/or problem gambling issues and their contributing factors, as well as assess community resources and the community's readiness to address these factors. So over the course of the project, and especially during this first 6 months, Julie and I have mentioned the importance of taking the time to look at your local community data that is across the lifespan to really assess the prevention priority areas that are outlined in the RFP, just to start building all the resources that you can specific to local data, again, across the lifespan. In step one of SAMHSA's SPIF, prevention professionals gather and assess data from a variety of sources to ensure that substance use prevention efforts are appropriate and targeted to the needs of the community. It is important during the assessment step to gather as much local data as possible to help guide prevention efforts. Data should again reflect the entire lifespan and each county within a designated service area. So again, look at this really as an opportunity to take the time to engage some maybe key partners that there's an opportunity to build a relationship with, or maybe kind of going back to the drawing board and looking at what data has historically been used to see if there are gaps, again, with certain populations of focus where additional data can be gathered. So data helps prevention specialists identify and prioritize the substance use problems and/or problem gambling problems present in their community. It helps clarify the impact of these problems on community members. It identifies the specific factors that contribute to these problems and helps assess the readiness and resources available within a designated community. So on this slide, we kind of crafted 4 different questions to consider when you're working through the assessment phase, being what substance use and/or problem gambling problems are occurring, how often are the identified issues occurring, where are the identified issues occurring, and who is impacted the most by the substance abuse problem gambling issues identified. And again, this loops back to Julie's recent comment about this really is community driven, and it's a vital part of the SPIF process to engage as many community members and various sectors within the work through the SPIF process. So engaging key stakeholders in all aspects, again, is important to ensure that there's buy-in and support, again, which leads to the sustainability of prevention services. Sharing your assessment findings with your community members is also really important, and we want to make sure that there's that dialogue amongst your collaborators, because the better that your community members understand the needs, the more likely they're going to be to participate in prevention services within the awarded counties. So building off those 4 questions from the previous slide, we want to consider these 4 additional items. The first is taking stock of existing data. So start by looking for state and local data that's already collected by others, such as hospitals, law enforcement agencies, community organizations, state agencies, and epidemiological work groups. Next, look closely at your existing data. Examine the quality of the data that you've found. Discard the data that's not useful, and create an inventory of the data you feel confident about including in your assessment. Next, identify any data gaps. Examine your inventory of existing data and determine whether you are missing any information. So this could include information about a particular problem behavior or population group. And then lastly, collect new data to fill those gaps. If you are missing information, determine which data collection method or combination of methods represents the best way to obtain that information. During this process, the data may reveal that the community has multiple areas of need that are contributing to substance misuse or problem gambling. And again, here at the department, we really value the importance of taking the time to really spend or dedicate effort to that assessment step to have a true understanding of what is impacting or how those prevention priority areas are impacting your awarded service area. So next, we're going to talk about risk and protective factors. So prevention specialists have long targeted risk and protective factors as influencers of behavioral health problems. So after selecting one or more prevention priorities, prevention specialists need to assess the factors that are driving or alleviating these problems. Targeting appropriate factors is key to producing real and lasting change. As the name suggests, risk factors increase the chance that certain problems will occur, while protective factors reduce the likelihood of these problems occurring. Identifying which risk and protective factors exist in a community can reveal opportunities to influence substance use patterns and behaviors. To be effective, prevention strategies must address the underlying factors driving these patterns and behaviors. It doesn't matter how carefully a program or prevention service is implemented, if it's not a good match for the problem, it's not going to work in your community. Also, remember that the factors driving an issue in one community may differ from the factors driving it in another community. Again, when we look about assessment and looking at local data, it's going to be important to look at all the counties within an awarded service area, as those priority issues may impact each county slightly differently. Because every community is unique, it is important to determine which factors are contributing to substance use and related problems in your community and to address those. There are an abundance of resources related to risk and protective factors online, but for today's training, we wanted to focus on the overall concepts of these factors, and we will provide further information and guidance specific to this topic moving forward. So next we're going to talk about resources and readiness. So assessing a community's capacity to address substance misuse and or problem gambling is a key of the prevention planning process. Understanding local capacity, including resources and readiness for prevention, can help you make realistic decisions about which prevention needs your community is prepared to address, and identify available resources you are likely to need but don't currently have to address identified prevention needs. Assessing community readiness in particular helps prevention specialists determine whether the time is right and whether there is social or community momentum towards addressing the issue or issues that you're hoping to tackle. Community readiness is just as important in addressing community needs as having tangible resources in place. So again, before we move on from that slide, just wanting to reiterate the importance of wanting to make sure that there is that community level buy-in with the prevention services that are chosen to help support and enhance and then eventually sustain prevention services within the awarded area.
Now we're going to talk about capacity, and I strongly believe capacity is something that we need to continuously provide. And one thing that we didn't mention at the beginning is that SPIF isn't necessarily a linear process. This is a process that often happens simultaneously. There may be steps that you're implementing at the same exact time, or there may be steps that you have to go back to. Capacity is one of those. Often, as we need community support for the work that we're doing, we're constantly building capacity as we move through every step of the SPIF process. So capacity is the second step of the SPIF, and it really involves that building and mobilizing local resources and readiness to address those prevention needs. A community needs both human resources and structural resources to establish and maintain a prevention system that can respond to local problems. It also needs people who have the motivation and the willingness or the readiness to commit resources and address identified prevention needs. And the reason for that is we really do need programs or interventions that are well supported. If they're well supported, they're more likely to be sustainable because people in your community will get behind them. So that's really the key component, is making sure that you have that community-based support for the work that's going on and you have the right people at the table. So some components of capacity building that are important to point out. As Katie mentioned, we look at readiness, but we also need to provide some awareness raising. So that's to help increase that readiness around a specific issue, and it also helps increase potentially available resources, not only monetary resources, but then people power, making sure that you've got the right people at the table. So if you're wanting to raise awareness, here's some things that we'd want you to consider. One-on-one meetings with community leaders to really share concerns and share information, stakeholder input from a specific sector, awareness through articles. I know in some communities, the best way to get information out is still a press release. So depending on the group that you want to hone in on to get information to, an article may be a really great way to do that. Utilizing websites or social media, once again, depending on your population of focus, who do you really want to reach? And that hosting community events, maybe like a town hall meeting, or conducting focus groups or listening sessions. So those are some ways to build that awareness or raise awareness. It's also really important to, as we've mentioned a couple times, to engage a wide, diverse group of stakeholders to engage in the SPIF process to address those specific prevention priorities or issues that your community has identified. You really want to include a variety of partners, and it may be folks that aren't typically a part of your prevention work. Some sectors that you may want to engage are business, law enforcement, education, healthcare, community groups or organizations, and then local government. You want to build relationships with those who support your prevention efforts as well as those who do not. Even if you've had some challenges maybe in the past, it's really easy to maybe count those folks out, but it's very important to make sure that you've got the right people at the table, even if there's been some maybe challenging relationships in the past. So stakeholders can help you in a variety of different ways. They can help share information about that prevention priority or issue that you're trying to address. They can share information about the strategies you're wanting to hopefully implement down the road. They can help raise that awareness about a specific issue, build support for your project and what you're trying to do, and then help make sure that prevention services are a good fit. They really need to be at the table when it comes to selecting those services or strategies. We'll talk more about that in just a minute. So we know that the issues that we're addressing are complex and they require insight from a variety of different sectors and people and efforts. So we can't do it alone. So we really do need to think about collaboration as a very positive way of doing things. Does it take additional effort? Yes, but it will maximize the work that is happening. And there's only so much time, resources, funding that you have available to do the work. So if you can get people on board to assist you, that's only going to expand your efforts. One piece that I think is really important in the capacity step is really looking at who is doing what in your communities. And I know sometimes people will say, well, I've been doing prevention for 20 plus years. I really know everything that's going on. I can't tell you the number of times that we have had a community start implementing a strategy only to find out that the police department is doing it, the same strategy, or there are 5 other agencies trying to do the exact same thing in a service area, and you as an agency can't get anyone to come into your doors. So it's really important that you identify who is doing what, all those different prevention resources in your service area and your county and your community, and that will also help you identify who can be your partners and champions too. Another thing that this does is help reduce duplication. If you have someone in your community that is taking care of life skills, and great, then you can focus your efforts on something else. There is plenty to do. So it's really important that you have a really good finger on the pulse of what's going on in your service area. So we want to engage sectors from across multiple disciplines. Like I mentioned before, it may be some kind of non-traditional partners that we want to bring to the table. And we can do some brainstorming as a prevention team or through your coalition on who maybe should be engaged. And that collaboration can, as I mentioned, help identify resources in the community, can help identify who's doing what. That can be a part of the prevention efforts you're trying to address, extend the reach of prevention or sharing of information, and then also ensure culturally competent prevention efforts. If you're bringing people to the table to help with a specific issue, to address a priority area, it's really important that we're clear on the purpose of the collaboration. I know when we were trying to set up an advisory council about 10 years ago, I met with every advisory council member and explained the project and where I thought that they could be a real benefit. And we still have people who started with us that have stayed with us this whole time. So it's really important that you're bringing people to the table, but you're giving them a reason why that they should be assisting. Establish clear roles, who is going to be doing what, especially if you have multiple agencies or multiple maybe people with the same skill set, helping everyone understand who is taking care of which components, and then discuss responsibilities.
All right, so we're going to be talking about the third step of the SPIF, which is the plan. And I think sometimes in prevention, it's really easy to jump into planning for prevention services. But in order to be true to the strategic prevention framework, it's really important that prevention professionals take the time to really marinate in the assessment phase as well as the capacity phase before a plan is starting to be developed. And again, that's in essence to make sure that the best prevention services are being selected to meet the needs of the community at large within that awarded service area. So again, it clearly is aligning with selecting the most appropriate services for that community. So strategic planning increases the effectiveness of prevention efforts by ensuring that prevention professionals select and implement the most appropriate programs and strategies for their communities. And one of the ways that prevention professionals do this within their communities is by developing a logic model, which we'll talk about a little bit more in depth later as well. When you're looking at the planning phase, it's really important that those stakeholders and those collaborators, that their input that they provided in those first 2 steps is applied within a prevention plan. Because again, this should be a collaboration. This should be something that there was time and effort and energy to go through that work to get to this point, and you want to make sure that stakeholder input is added value and they can see that their contribution and to this collaboration is meaningful. So an effective prevention plan should reflect the input of the key stakeholders, including those various community members. And collaborative planning processes are more likely to address community needs and then again be sustained over time. So when you're looking at the prevention plan, you're going to want to be taking into consideration, again, those risk and protective factors that were maybe rose up during that assessment phase. Looking at all the available effective interventions based on evidence-based practices, national registries, all of the available resources online to make sure that it's a good fit for your community. And again, the community members who are participating in these efforts are also contributing to really analyze whether or not this is a good fit for the community. And then again, establishing a logic model. So every substance use problem is associated with multiple risk and protective factors. No community can address all of these factors, at least not at one time. So during the planning phase, you will need to decide which factors to address first. To prioritize factors, it's helpful to consider their importance and their changeability. So importance describes how a specific risk or protective factor affects a problem. These questions can help you determine a factor's importance. So ask, how much does this factor contribute to our priority problem? And ask, is this factor relevant given the developmental stage of our focus population? And lastly, ask, is this factor associated with other behavioral health issues? When looking at changeability, it describes a community's capacity to influence a specific risk or protective factor. So the questions to consider specific to changeability are, do we have the resources and readiness to address the factor? Does a suitable intervention exist to address this factor? And can we produce outcomes within a reasonable time frame? So when developing a prevention plan, it is best to prioritize risk and protective factors that are high for both importance and changeability. If no factors are high for both, the next best option is to prioritize factors with high importance and low changeability. Since factors with high importance contribute significantly to priority substance use problems, addressing these factors is more likely to make a difference. And it's easier to increase the changeability of a factor than it is to increase its importance. And I think this is an important conversation to have too with your community stakeholders and your collaborators, is having the conversation about importance and changeability, because I think that really brings a lot of fruitful conversation when defining or starting to plan for which prevention services are the best fit within that community. So we're going to look at effective interventions. And sometimes people want to select interventions that are popular, that worked well in a different community, or that they're familiar with. But these are not good reasons for selecting a prevention service. It is more important that the prevention service effectively address the priority substance use and or problem gambling issue and associated risk and protective factors, and that the service is a good fit for the broader community. When choosing appropriate prevention services, it is important to select programs and strategies that are evidence-based. So as we talked about in a previous webinar, Evidence-Based Interventions Have Documented Evidence of Effectiveness. The best places to find EBPs are federal registries of model programs, but it's important to note that these sources are not exhaustive and they may not include interventions appropriate for all populations or problems. And again, I would just reiterate to, when available, to look back at that additional webinar or to contact the IPN help desk if you have any additional questions specific to evidence-based programs. The other concepts that we talked about in a previous webinar but are part of step 3 are looking at conceptual fit and practical fit. So as a reminder, conceptual fit directly addresses one or more of the priority factors driving a specific substance use and/or problem gambling issue and has been shown to produce positive outcomes for members of the target population. So the question to ask when thinking about conceptual fit is, will this intervention have an impact on at least one of our community's priority risk and protective factors? And then thinking about practical fit, it's, is it relevant for the target population or the population of focus? Does the community have capacity to support it? And does it enhance or reinforce existing prevention activities? And the question to ask when thinking about practical fit is this intervention appropriate for our community? So next we're going to talk a little bit more about logic models in the planning phase. So a logic model is a visual tool that shows the rationale behind a program or a process. It's like a roadmap. It tells you where you are, it tells you where you're going, and it tells you how to get there. It's a really good visual representation to help keep the prevention service on track. And it helps collaboratively for not only prevention professionals, but also stakeholders, coalition members, etc., see the process from beginning to end. So when you're looking at a logic model, what it does is it identifies the problems that the community identified. It specifies the risk and protective factors within a community that are influencing the prevention priority areas. It outlines planned interventions, and then there's also that ending where you're able to capture your anticipated short and long-term outcomes. So looking at logic models, again, it explains why your program is going to succeed, and also allows you to, again, just see more of a big picture of where you start and where you want to end up. It identifies gaps in reasoning. So again, by having more of that linear kind of a model with a logic model, you're able to see all steps and the way that you're going to move through the process to reach the end goal. And it makes evaluation and reporting easier because you know exactly when surveys are going to be administered or when outcomes are going to be collected. It just helps with that process and again, from beginning to end throughout the entire project.
Now I'm going to talk about the implementation stuff. So this is really when you're putting that plan that you've created into action. So there, you're looking at delivering those selected evidence-based interventions. So implementation requires a clear action plan and fidelity and planned adaptation, and then implementation supports. And we're going to be talking about each of these in just a minute. So an action plan is something that we certainly have required in many of our grants in the past. You probably either called them or heard them called action plan or work plan. And there's a couple of different types of plans that we use here at the department. But just in summary, an action plan or work plan describes how prevention services will be implemented. It's a document that lays out exactly how you intend to move a specific program, policy, or strategy forward. It also describes what you expect to accomplish, the specific steps that you need to take to get there, and then who is going to be responsible for doing what. And this is a really helpful tool. I kind of look at an action plan as a to-do list for you or any of your partners that are assisting with implementation, the steps that surround this whole process. It's going to help keep everyone on track and help everyone to know those core components that you need to implement to make sure that the strategy or program is successful. So we talked in one of our previous webinars a little bit about fidelity and adaptation, so we're not going to talk in depth about those topics now, but as a reminder, when you're implementing, you still need to be adhering to the fidelity and making sure that you're with any adaptations that they're planned. So fidelity is the degree to which a program or practice is implemented as intended. And so you want to make sure that you're adhering to those fidelity processes, that you've got a plan in place to monitor fidelity, especially if you're working with community partners to help implement a program or strategy. And then adaptation describes how much and in what ways a program or practice is changed to meet local circumstances. We also just want to figure out ways that we can balance that fidelity and adaptation. So there's a couple of things we want to keep in mind. We want to focus on retaining those core components. We know evidence-based programs and strategies are more likely to be effective when their core components are maintained. And core components are really the elements that are responsible for producing positive outcomes. So those are kind of the key ingredients in a recipe. If you take one, maybe if you add some nuts to your chocolate chip recipe one time and you don't another time, you're still going to get great chocolate chip cookies. But if you decide you're going to remove flour, you're probably not going to be very successful in making cookies. So that's kind of a good way to think about it. It's that those key ingredients to a program. So there's some general guidelines for maintaining those core components. One is to preserve the setting as well as the number and length of sessions. Preserve key content. It's safer to add rather than subtract content, as we've talked about already. And then add content with care and consider the program guidance and prevention research. We also want to make sure that if we're looking at changing a program, that we have really built capacity around that program. Sometimes what tends to happen with the SPIF is that we haven't spent enough time building capacity, and then we get to implementation and we don't have the support in place to move a program forward. So if you're having some challenges with a specific program and you come to us, we're probably going to encourage you to come up with a capacity building plan or figure out some steps that you need to take to increase that capacity before you say, this program is a loss, we're not going to be able to move it forward, we don't have the support. Sometimes you have to go back and really dig deeper into the capacity step. So as I've already mentioned, another key piece of that balancing act is adding rather than subtracting. I think you still have to be very careful when you're adding and making sure that you're adhering to the program itself. You want to make sure that it's an element that's important, that isn't going to distract from those key components. We want to adapt with care. And so, and part of that is because we want to do programs that work, and we know that researchers have developed specific programs with those core components in place. So if we're removing one of those, we could really be damaging the effectiveness of the program. So that's why we are talking about this so much. We think it's really important that adaptation is not something we take lightly, that we really look at all the key components before we decide we need to adapt. And then lastly, making sure that you're consulting the experts. And experts could be a program developer, environmental strategy expert or specialist, or an evaluator that you work with through your agency or someone in your community that understands evaluation well. And they can tell you if an intervention has been adapted in the past and how well or not how well those adaptations have worked. And then certainly if you're wanting to make any cultural adaptations, you should consult with cultural leaders and members of that focus population first. So when we're implementing, we also want to have some really specific supports in place. Like I said, it's important that we have a variety of people at the table that are helping us with moving these strategies or programs forward. And we know that for agencies or coalitions or groups that have some of these in place, that you're going to be likely more successful. So when you're thinking about supportive implementation, one area of consideration is, does a group have a favorable prevention history? So an individual or an organization with positive experiences implementing prevention interventions in the past will likely be more ready and able to support the implementation of a new program or strategy. And if an individual or organization has had a negative experience with, or maybe doesn't fully understand the potential of a prevention strategy or program, then it will be important to address these concerns early in the implementation process. Another component to consider is on-site leadership and administrative support. Prevention programs or strategies assume many different forms and are implemented in a variety of different settings. And to be the most effective, those programs or strategies require leadership and support from key stakeholders. And that, I think, is very important, that you have the buy-in of leadership to be able to move a program forward. Practitioner selection is another component to consider. When selecting the best candidate to deliver a prevention strategy or program, consider professional qualifications and experiences, practical skills, as well as fit with the focused population. Another component is practitioner training and support. And we want to make sure that our professionals that we're working with and are responsible for implementing really understand why or how the program or strategy works. We want to give them opportunities to practice new skills. We want to give them constructive feedback. And since most of our prevention skills are learned on the job, it's also very helpful to connect these prevention professionals, maybe even with a coach who can provide some ongoing support. And then lastly is program evaluation. And I think sometimes in our field, we don't maybe take enough time to look at evaluation results because we're so busy moving from program to program or grant to grant. But it's really important that we take a look at how the results of our evaluation. So by monitoring and evaluating the delivery of a program or strategy, professionals can make sure that it's being implemented as intended and improve that process as need be. We also want to look at program outcomes. And if we're not seeing positive outcomes through our program implementation, it may be time for us to take a look at whether it's the best fit, or if there's something with the implementation process that's maybe not working well. And sometimes with some of our programs, it's just not the right time for the specific strategy or program. It may not be the right time, the right fit, the right people at the table, and that is okay. Now, just a reminder, we're hearing some feedback. If everybody could make sure that their microphones are muted, we would appreciate that.
Okay, so now that was a good segue because we're going to move into step 5 of the strategic prevention framework, which is the evaluation step. So evaluation is the systematic collection and analysis of information about program activities, characteristics, and outcomes. The evaluation step of the strategic prevention framework is not just about collecting information, but using that information to improve the effectiveness of a prevention program. After evaluation, planners may decide whether or not to continue the program. So prevention specialists need to evaluate how well the program was delivered and how successful it was in achieving the expected outcome. Once the program has been evaluated, prevention specialists typically report evaluation results to stakeholders, which can include community members and lawmakers. Stakeholders can promote your program, increase public interest, and possibly help to secure additional funding. So this is a vital step. I think that's one of the interesting things about the strategic prevention framework is that each step of the SPIF is really important to the success of the prevention program. And really wanting to take the time to walk through each of those steps, and then moving into that evaluation component, really understanding how evaluation can be used to better enhance again and support prevention services now and in the future. So evaluation and the SPIF, it is more than just the final step. It should be part of every aspect of the SPIF, from assessing needs to communicating results. During an evaluation, prevention specialists can ask themselves the following questions. How successful was the community in selecting and implementing appropriate strategies? Were these the right strategies given the risk and protective factors the community identified? Were representatives from across the community involved in program planning, selection, and implementation? And if so, what ways were they involved? Was the planning group able to identify potential new partners with which to collaborate? And what was the quality of the data used in decision making? So engaging stakeholders who represent the populations you hope to reach greatly increases the chance that your evaluation efforts will be successful. Stakeholders can guide whether or not evaluation results are shared, and stakeholder involvement also helps to ensure that the evaluation design, including methods and the instruments used, is consistent with the cultural norms of the people you serve. And the next the IPN prevention webinar that you will all be participating in is Prevention Evaluation 101, in which we'll provide additional guidance specific to evaluation expectations in relation to department-funded prevention services.
So now we are going to talk about the two guiding principles of the SPIF process, which I think, as I mentioned, I think makes this process more unique. So the first is cultural competence, and I also like to use the term cultural responsiveness because I don't know if we ever reach the level of competence when it comes to culture, but it is certainly something that as prevention professionals we need to keep on our radar in all the work that we do. So cultural competence is the ability to interact effectively with people of different cultures, and in practice both individuals and organizations can be culturally competent. This process is embedded, or cultural competence needs to considered in every step of the SPIF, and really the term means to be respectful and responsive to the health beliefs and practices, the cultural and linguistic needs of diverse populations or groups. So cultural competence is evolving, dynamic, it takes time, and occurs along a continuum. And I think one thing that we have learned over the years, or we've tried to help people understand, that it is broader than race and ethnicity. So it can encompass age, gender, faith community, religion, disability, income level, geographical location, and profession. And I'm sure there's even more than just this list that we have noted. So we also, as I mentioned earlier, cultural competency can be a part of what we do as an individual in the prevention field, but then also we want to make sure that we have a culturally competent workforce. And so certainly these are some components that we want to focus in on. We want to understand the cultural context of the communities that we're working in, and if there's a specific population that we want to focus in on, we want to understand the cultural context of that community. We also need the willingness or the skills to work within this context, making sure that we're getting training and resources to be culturally competent in the prevention work that we provide. that we draw on community values and customs, that you're engaging folks from a variety of different backgrounds and with helping you plan and go through the SPIF process, including all members of community in that process or leaders from that community in your prevention efforts. We also want our organizations that are providing prevention services to be culturally competent as well. And there's some ways that those organizations can go about that work. And one is to continually assess organizational diversity, and that happens through conducting a regular assessment of an organization's members' experience in working with diverse communities and focused populations. This organization should regularly assess the range of values, belief, knowledge, and experiences within the organization that would allow for working with focused communities. Another component is investing in building capacity for cultural competency and inclusion. And so making sure that organizations have policies, procedures, resources in place that make ongoing development of cultural competence and inclusion possible. And ideally, it would be great if organizations would commit resources necessary to build or sustain relationships with groups and communities, including representatives of the focused population within the organization's ranks is especially useful. Another component is practices strategic planning that incorporates community, culture, and diversity. And so making sure that organizations are collaborating with other community groups, its members are encouraged to develop supportive relationships with those community groups. Implement prevention strategies using culture and diversity as a resource. So, and we have to be a little bit careful with this one because we don't want folks from specific populations coming in and being our interpreters or giving, having them create materials that we're going to be distributing. So it might be best if you use a professional service just to make sure that the information is correct. But it is helpful if you can bring in, if you're wanting to do some focused outreach or focused services to a specific community, bringing in leaders from that community and asking for the best way to do that, or what kind of materials would be best. Once you've created some, having them review them. So making sure they're a partner in at the table, but being really careful about that interpretation process. And then lastly, evaluates the incorporation of cultural competence. And community members must have a forum to provide both formal and informal feedback on the impact of prevention services. And then lastly, because we're running out of time, I'm not gonna go through all of these, but you can find these online. And actually we can probably just provide the link, but these are some great principles to consider from the Center of Substance Abuse Prevention through SAMHSA. So if you're thinking about being culturally competent in the prevention work you're doing, I will also say that the Department of Public Health is focused on health equity. So you're gonna be hearing more about that term. And then SAMHSA, through some of their grants, also focuses on the national standards for culturally and linguistically appropriate services in health and healthcare, or CLAS standards for short. And that will be another component you'll be hearing more about as we move through the IPN project.
So the second guiding principle is sustainability. So the sustainability of prevention outcomes is often seen as the culmination of program planning and implementation. However, that assumption will place your program at a disadvantage. Effective programs plan for sustainability from the beginning of the program design. Sustainability should be revisited and revised throughout the life of the program, and that goes back to Julie's earlier comments that the strategic prevention framework is not linear. And it's a circle for a reason, so wanting to go back and forth throughout those steps, and again, having sustainability and cultural competence and or responsiveness being embedded in each step of the process. The ultimate goal is to sustain prevention outcomes, not programs. Programs that do produce positive outcomes should be continued, but programs that are ineffective should not be sustained. Key activities involved in ensuring sustainability include building support, showing results, and obtaining continued funding. All of these activities require time, people, and ongoing planning and evaluation. SAMHSA emphasizes sustaining the prevention process itself, recognizing that prevention specialists and stakeholders will return to each step of the process and again as communities face evolving problems. So moving on to stakeholders and result sharing. Program stakeholders represent a diverse group of people. Involve them early on and find meaningful ways to keep them involved. Stakeholders who are involved in initial assessment activities are more likely to support prevention efforts that stem from the assessment. Even if your evaluation process reveals that you weren't able to meet all of your goals, this information is valuable. Failures and challenges that emerge from the evaluation process allow you to see what worked and what didn't. This information will help you highlight problem areas in the program and where to make necessary changes. And more importantly, this data can help you decide if the program or certain elements of your program should continue. And that's something that the department will review as well, looking at the data results that are shared at the end of the programming. Did we achieve what we set out to achieve? Is it a good fit? Is it specific to an Institute of Medicine category? Is it not a good fit for an Institute of Medicine category? So all of those things are taken into consideration in context to that. And then lastly, find people on your team and in the community that are willing to speak about and promote your prevention program efforts. These champions will help represent your program in the media and help you develop promotional materials for the public and to attract officials as supporters. There are several resources available online that provide additional tools to teach organizations how to assess needs, build resources, and effectively plan and implement prevention programs. So that was, I would say, kind of a high-level strategic prevention framework overview, but a good introduction into each of the 5 steps and the 2 guiding principles. So this concludes the webinar on the strategic prevention framework, and we thank you.